Introducing the African Diaspora News Channel app, your gateway to stories that's overlooked by the corporate mainstream media.
And we serve as the voice to the global Black community.
Again, we got Dr. Candace Matthews.
A lot of these documents, looking at.
We are committed to informing and educating through the power of media.
This country is supposed to be about the land of the free for all. It has not been free for Black people, and we are tired.
With our platform, we're helping to end injustice by exposing it.
Join us in standing for excellence in journalism and serving our community. Download the African Diaspora News app today.
So Ghana is reporting an alarming rise in the amount of HIV cases. In just 9 months, up to 34,000 positive cases of HIV after testing 1.3 million people. That's 38%. That's a pretty high number. And that's just the ones that we know of. I'm sure there are several that are walking around that don't know, haven't gotten tested, and are possibly transmitting it along to other people. So take a look at what happens when some youths were asked the question of whether or not they intend to get tested.
This one is a more personal question. Have you ever tried or have you ever thought of testing if you're HIV positive or negative before?
No.
Why?
I don't see me I'll be okay. Because I don't even know why somebody just go to know them, go hospital to go check.
I mean, you have to.
What you want to see. Me I'll be okay. But I feel like if you be sexually active a lot, then that one day for check bar. Me like this, I'll be normal. I'll not be active like that. So I'll be why for go hospital to go check for what?
To know and protect yourself if you don't have. You get it.
I'm safe.
As a normal adult, where say you be sexually active. If for be ignorant like that, at least once in a year or something, at least find ways and means and check if you have complications, not even HIV per se, but those STIs, gonorrhea and syphilis and stuff. You have to check. You have to be healthy, Charlie. You have to be healthy.
Listen to your brother.
Something. In my own perspectives, I doubt that, because if you're saying that every day 50 people construct that, what are your actions towards it? Because I would say that if I am a man, you're a woman, you have sex today, I give it to you. And if you go to the hospital and they tell us that we are constructed of those diseases, what do they do about it?
So when someone...
We can't take it to other people.
Okay.
If 50 is today, how possible that another 50 people come tomorrow?
So that's the thing. If you get tested for HIV, it doesn't mean you're doomed. It doesn't mean you're doomed. You can be on medication for a number of time or a period of time that the HIV symptoms or whatever virus that's in there will reduce, so much so that you will not even develop into AIDS. You get it? So it's good to check. That's why I'm asking you guys if you've checked or you've not. So if you have not, kindly do so to check. No, not be like about or you never.
Me, I'm safe.
I'm safe. You too.
Oh, me, I know I'll be safe, 100%.
So as you hear, one of the young men are saying, "Oh, I'm good. Don't worry, I'm good. I don't have to worry. And why should I get tested? And what am I going to see? And what's the point of it, basically?" And then another one was trying to be the voice of reason and saying it's important to get tested. And then another one is saying, "Oh, I'm good. And that's part of the problem. You have these young people that are out here promiscuous. Maybe they are, maybe they're not being protected, and they feel like they're fine. How do you know unless you get tested? It's very important, if you are somebody that's foolala active, to just make sure you get tested. And if you are, use protection. That's what it's there for. Is it not worth it to protect yourself than to potentially be at risk for an incurable disease, an incurable infection, one that stays with you for life and that can affect your livelihood or your life ultimately? And then also the advantages of being tested is that they now have all different kinds of medicines that are antiviral, that you can basically fly under radar and be undetectable and also untransmittable. So there are many medicines now that they didn't have back in the day, but isn't it better to test yourself and make sure so that if, God forbid, you are testing positive, that you are, you're able to take care of yourself and be okay? Wouldn't that make more sense? Wouldn't that be the more responsible thing to do? But first and foremost, it's about raising awareness and it's about getting tested. It's about educating yourself. In Ghana, they have self-tests as well. You can get a self-test. So why not make sure you cover yourself? 9 months of the year's not over yet, and we're already up to 34,000 cases, is very frightening and it's very concerning. So please, people, educate yourself, get tested, use protection, abstain altogether if you can. Remain monogamous and responsible if you're in a relationship. These numbers are not a joke. And again, I say, that's what's been reported. That's just 1.3 million people that were tested. So imagine what could potentially be out there. So please, this is my country. Auntie M is speaking. Get yourselves tested, practice safe fula lying, and let's bring these numbers down. Ghana has a goal of ending this epidemic by 2030. So please, let's be responsible. Let me know what you all think about this. Don't forget to like, subscribe, and share this content. Also, download the African Diaspora News app. You can grab it at the Google or Apple store, and you will not be disappointed. Download that app and subscribe to my YouTube channel, The Black Experience with Emma Ansah. Until next time, please be safe, everyone.